Welcome to the Lagniappe, a little something extra for your health, your family, and your future. Hosted by Caroline Badon, wife, mama, fitness and wellness guru, fashion and iced coffee lover, and the marketing director and podcaster for the Fussell Group. This podcast is your go-to for real conversations, expert insight, and the heart behind the Fussell Group's mission. Because life's not just about getting by, it's about showing up with purpose and serving the community with what matters. Let's get into it. Welcome back to the Lagniappe podcast. I'm your host, Caroline Badon, and today I am here with the sales director of Devoted Health Plans, Eric. How are you, Eric?
Absolutely awesome.
Thank you so much for joining us today. Today, we're going to spotlight a company that's really reshaping how healthcare is being done for older Americans, right? With Devoted Health. I know the mission for you guys is simple: care for every person like family. So let's get into that. The status quo in healthcare is really falling short. If you do your research on Devoted, you know that they're very, very passionate about that. And the U.S. spends more per person than any other developed country, yet our outcomes are worse.
Absolutely.
Right? So the system has built 100 years ago, this system around infectious disease, but today chronic disease is the bigger challenge. So how does Devoted take a different approach to solve that problem, like other than these other healthcare plans?
You know, that's a great question. And our founders, if you listen to some of the videos they put out and watch some of those things, you'll see that they never intended to be in the insurance industry. That was not the plan.
Right.
The plan was, how do we improve the health outcomes of Americans?
Right. Specifically for their mom. Right?
Exactly. Yeah.
Yeah.
Mom and dad were
Yeah.
aging into Medicare. And how do you do that? And how do you reach the masses? You could open a bunch of practices, but do you really reach the masses? And do you really change the face of healthcare? And
Right.
you really don't. And so they never imagined themselves as founders of an insurance company. Ed is our CEO, Ed
Mhm.
Park. And he said, I look at, being a CEO is just like of an insurance company as just, was that Simpsons character, that
Yeah.
old guy character? Same
Yes.
kind of thing, right? And
Right.
it's like, I don't want to be seen as that. And you'll
Right.
see him
Status
walk.
quo.
Exactly.
Mhm.
And so how do we attack it? How do we do it better?
And change that. Yeah.
Right. And so they're tech geniuses.
Yeah.
So part of the thing they came up with was a software that sort of encompassed everything all at one time. And so that way all of our people within our company can actually see everything that's going on
Mhm.
with maybe a member that calls in. And so that helps service those folks faster. Also all encompassing in that is our billing and payment side of things as well. So it allows us to pay our partner providers faster, because you can't get to the next level of better healthcare
Right.
without a partnership with the doctors
With the
and
providers and them
right.
wanting to have that partnership with you.
Yeah.
I think just from being a licensed insurance agent myself, a lot of things we hear from our clients is, oh, well, my doctor doesn't like that plan, or well, my doctor doesn't, my doctor wants me to be on this plan. And it's funny because it really is all about that partnership and that relationship the plan builds with the doctors. You're so right about that. Yeah. So what does right care, right place, right time mean in practice?
Yeah, that is pretty outstanding. It is. You have to start off with good plans, otherwise people are not going to want to be on them.
Right.
But they also have to meet certain criteria to have high standards, because the federal government rates us based on a star rating and all of those things.
Right.
And so we have to have great care within the plan itself, but then we have to have people that appreciate and want to be on those.
Right.
And so part of that thing is to actually have American-based customer service. So we call our customers.
It's huge. It's
Oh,
huge.
it's massive.
You don't
Like,
find that anywhere anymore.
nowhere. You're always calling and you hear chickens clucking in the background and people.
Dogs barking and people of
Right.
different languages trying to communicate with you, and it's frustrating.
And here we are in the South, and people like to talk with people that sound like they're from the South. And we have a lot of people living actually that are within Devoted already living in Louisiana. So
Right.
we have a lot of work at home is sort of the platform for that.
Great.
And so when they call, they get somebody in around, I think it's like 84, 87% of the time. within 30 seconds, you have somebody answering the phone.
Yeah, we're gonna get into that because I think that is stellar.
It's unreal.
Let's talk about why is a proactive coordinated model so important for seniors?
Oh yeah, it's you want to treat. You really want to look at treating somebody, not just putting a band-aid on things. You actually want to treat them so they don't get sick,
Right.
right? We want to care for people to keep them healthy, and so you
Hmm.
want to take a proactive approach to their healthcare. That means eating things correctly. So
Right.
when a doc, I'll give you an example. If you have diabetes and you go to the doctor, and the doctor just hands you a nutritional guide,
Hmm.
and then we're like, "See you later, I'm out."
Good luck.
And then there's it's not that the doctor is not trying to care for them,
Hmm.
but there's a gap in that health. And so we have actually devoted medical team that is behind the scenes.
Wow.
And the devoted medical team will constantly reach out to those individuals to say to to relate different things like, okay, let's look at your diet
Hmm.
and let's look at the things that you're eating and how you're feeling. Oh, I'm
Right.
feeling really tired. And then we look at the things they're eating and see which things we could take out,
Hmm.
replace with something healthy, and then we ask them, now how do you feel?
Right.
And now they're like, wow, I feel more energetic, I have
Hmm.
all this, extra stamina for the day, all these things, and now they're relating it to what they eat, so it keeps them away from the bad stuff and onto the good stuff.
Nutrition is everything.
Absolutely.
We have to stress that, especially in today's generation, because the choices out there are just so poor for the human body,
Yeah.
mentally and physically, and even emotionally. Like things that you eat make you feel a certain way, and then that affects everything else in your day to day life. So that's a huge thing that Devoted has going for them too.
Absolutely.
So let's talk about the fact that Devoted isn't just a tweaked old system, like
Mm-mm.
it's something new. Can you walk us through the five ingredients that make up your all in one healthcare model?
Absolutely. It does all start with the plans.
Hmm.
We have to have really great plans that take a proactive approach to their care. So that's kind of the first ingredient. And then you have our guides. And that
Yes.
is those customer service folks that answer the phone. They do not have a time limitation on them at all.
Hmm.
We want to build relationships because let's think about proactive care. Is it really about just your internal health or is it also mental health?
Right.
So if you have somebody you can talk to every single time, that's pretty amazing, right?
Yes.
And there's a lot of these people. I remember when I was an agent starting in this industry, and I would have customers that would call me like almost daily because they
Hmm.
had no one else to talk
They
to.
just want to talk.
Right.
Yeah.
So you can actually, once you build and establish a relationship with our guides, a lot of the guides will say, "Hey, just if you can actually ask for me and request me," and then
Hmm.
they'll get that person
That's
back.
awesome.
That's unheard
So
of
they
in the
know they're
industry.
talking to Joe every time they call.
Exactly.
It's that
Yeah.
comfort and trust feeling that they're building.
Right. Yeah.
Yeah.
And then, of course, we have our provider relationships that I was talking about. They do the work, they need to get paid. So we
Right.
pay them within a week. That's unheard of in the industry. The next closest to what we do is around 90 days is the average time that a
Hmm.
doctor gets paid from a provider or from a carrier. And that's just not right.
Right.
They're doing the work and so they need to be,
Paid.
paid.
And that builds a better relationship, which makes them
Yeah, exactly.
want
Want to
to
partner with
represent you.
us.
Yeah.
Yeah, to
To partner with
do
you.
those things. Yeah.
Yeah.
And then, of course, we have the Orinoco system because our Orinoco is that software-based system that the guys had created. And
Right.
so where they came from is pretty amazing. So they actually built Athena Health. Well,
Okay.
Athena Health is the software company that basically it was a billing system for the healthcare industry. It was
Right.
the first cloud-based system out there.
I've
Um,
seen it on some of our personal billings.
Exactly.
Yeah.
Yeah. It's so they built that. That was the first one ever created.
Wow.
And so they're absolute tech geniuses. That's what sort of got them into, by accident, the health insurance industry or the healthcare industry. That's where it all started. They went public with it. Then they sold that business for over $6 billion. And they really didn't have to do this,
Right. They
right?
wanted to.
They wanted to have something that would be legacy, something that they could put their name on, and they're not selling.
That's what we're
That's
about
the most
here.
incredible thing.
That's exactly what we're all about here at the Fussell Group. It's just being the gold standard, creating that legacy. It's not a sales pitch. It's all about helping the senior, giving them the knowledge they need to know to be on the right plan because they don't know what they don't know, you
Right.
know? And that's why we're here. So, in-house and virtual and in-home care, we talked about that as well, especially with the nutrition and things like that. That's just another one of those ingredients to
Yep.
the magic mixture of devoted.
Yes, that medical side of things, the actual devoted medical is what we call it.
Mhm,
It's really amazing. Like we even have a devoted to me that actually outreaches to the member, and it's about an hour-long conversation with our clinical team to
mhm,
see what bridges we need to gap between their doctor visits and us personally. And then also, this is something that's we piloted over the last couple of years. It's been super successful. And we're not trying to compete with our partners that are also primary care, but you have people like me that are so busy that they can't get to the
to the
doctor or
doctor,
whatever.
right?
So we do virtual PCP as well internally.
Nice.
But then you think about when you think about seniors living in all these areas that are like super rural, they may not be able to afford transportation to get to the doctor. And so this is a way to connect that dot directly to them. And
Mhm,
the cool thing is, if we have a FaceTime going, what are we seeing that a doctor is not?
right,
Living conditions. Do
exactly.
they have tripping hazards? Do they need a deck built?
Mhm.
Anything like that that our community guides can outreach and help them do those type of things as well.
That is awesome.
Yeah.
Okay, so which of these do you think has the biggest impact day to day on your members?
Oh my
For me, I would say probably just the incredible customer service. But of course the plan too, because that affects them day to day. What do you
Mhm.
think?
I mean, it's hard to peel them apart because that, I don't think you could take one thing out of there and it be
As
anywhere
good as
near
it
the
is with all
same. It's
five.
like all five combined is the
Mhm.
perfect
It's the secret
system.
sauce.
It is,
Yeah.
absolutely.
So can you share a story of how a guide or a devoted medical provider has helped a member that you've experienced?
Actually, I was kind of alluding to it whenever I was talking about that, with connecting the nutrition.
Mhm.
So this really stuck out. We have stories like crazy. If you actually look up Devoted on like YouTube, it is absolutely incredible, all the stories that come from our guides. But one of the stories that always stuck with me was a lady, she was a elementary school teacher,
Mhm.
and once she retired, she still wanted to stay engaged with the kids, so she became a crossing guard, and she would volunteer her time to do
Sweet.
crossing guard stuff, right?
Yeah.
Stay engaged with the kids. She ended up getting so tired. She was so tired because and she really couldn't do her job anymore. Like she just wanted to sleep all the time.
Mhm.
So her diabetes started getting worse because she was depressed and she was depressed eating, that's a
Right.
kind of a thing. And
It's like a trickle effect.
it is, and it like compounds and it
Mhm.
makes you worse and worse and worse. So she got on a devoted plan and it was during annual election period, which is coming up.
Right.
And during that time, so we started with her in January. It took us 3 months, so a little less than 90 days to get her back as a crossing guard. She had to quit as a crossing guard because she couldn't do it anymore.
Oh, wow.
Our clinical team got with her, fixed her nutrition.
Mhm.
I can't remember how many points we dropped her A1C, but it's typically more than most drop in a year
Mhm.
with medication. We didn't really do it with medication, it was all nutrition. Brought it back down, and she was back as a crossing guard within 90 days of starting with us.
Isn't that amazing?
It's crazy.
You changed your life, you know?
Exactly.
And that's what I love so much about this industry is you have the opportunity to do that for people every single day.
Exactly. Yeah.
So why do you think the continuity of care, like continuing the care matters so much for seniors with multiple conditions?
Well, if you think about it, if we can fix a lot of those problems, which are fixable with things like nutrition, and if you actually have that constant connection with them,
Mhm.
whether it be virtually or over the phone, that emotional support as well, you do all those things. It has a tendency of keeping people out of the hospital.
Yeah.
It's pretty amazing. And then what you can do with the money that you save by keeping people healthier is create better plans.
Mhm.
So they
Exactly.
have a
Again,
tendency.
it's a trickle effect.
Exactly. It's amazing how that works.
The service that I've read about Devoted is what really stands out to me. I was amazed by the statistics. So, over 80% of your calls, like you said earlier, are answered within 30 seconds or less. And then 93% of those are resolved on the first call.
Right.
That is very unheard of. How do you guys train your teams to deliver that kind of service?
It's pretty extensive because like I said, that with that Orinoco software system, they can see everything from
Hmm.
claims to calls to clinical, everything. And so why that's important is connecting all those dots is absolutely critical to what we do.
Yeah.
Yeah.
And it makes such a difference in the life of the senior
Mhm.
because they know when they call, they're going to get the help they need. It's not the dreaded, I have to wait for 30 minutes to speak to someone from Indonesia
Right.
call, you know?
Exactly.
And that's just another pro of Devoted
Mhm.
is the customer service.
Yeah, and they're not going to get transferred all over the place.
Right.
So the only way they're going to get transferred is if they have a specific healthcare related need that they need to be transferred to the health guides, the
Gotcha.
our devoted medical, or they could get transferred potentially if they have community needs. Like
Okay.
if we need to help them sign up for Medicaid or get
Hmm.
extra help for LIS, or if they need a ramp built on their house because they don't have the money to do it, and maybe they're handicapped or something like that.
And you have those
Well,
resources.
exactly.
That's
So,
amazing.
yeah.
So, what does your 94% trust score, the Devoted's 94% trust score, say about the culture of Devoted? Explain the trust score a little bit,
Yeah.
and then what it says about Devoted as a whole.
Yeah. So to get to that kind of score is it's you just don't see that in this industry.
Mhm.
It's something that we do within surveys and those type of things, but then also 2 out of 3 people actually refer us. Who does that anymore?
Wow.
So if you have out of 3 I'm sorry, 3 out of 5, apologies. 3 out of 5 people actually refer us for other people to become members of Devoted. We've grown like that our entire existence, and we
Mhm.
became, I think it's been the last 3 or 4 years, we're the fastest growing MA company in the country without doing major sponsorships, without doing major, marketing
It's
campaigns.
incredible.
It's working with
Organic growth.
exact organic growth, working with folks like you that actually care about the people,
Mhm.
that can put people on our plans, and then they start spreading the word of how good we do and how well we take care of people.
Yeah, and
So
that goes back to the quality. So
exactly.
Devoted's average star rating is a 4.3.
Hmm.
The national average is a 3.9.
Hmm.
So you've already surpassed the national average in your star rating. And then even better, 71% of your members are in a 4.5 star plan
Yeah,
or
exactly,
better versus the 30% nationally.
exactly.
So go into detail about that. How do you keep those 5 star, almost 4.5 star plans and keep those members in them and keep that star rating so high?
Well, remember I was talking about the partnership with the doctors and how
Hmm.
important that is? So, part of the STARS measures is to close gaps. Like, are these people going to the doctor? Are they getting their regular checkups and those type of things? If we don't help close those gaps, then it hurts our star ratings, and we
Hmm.
can't do that, right? So, we have to have those great partnerships with doctors to make sure they're getting those folks in, closing those gaps, and we help bring those folks in.
Right.
So we'll call them and say, hey, you need to go into the doctor. And if they can't, we'll get Devoted Medical to get on the phone with them and do a virtual visit to get those
Perfect.
done.
Yeah.
And that's critical.
So, why do these ratings matter to members? Why should a member care about being on a 4.5 star plan versus a 2 star or any why should that matter to the member?
It's extremely important because that's kind of Medicare's rating system for the plans.
Mhm.
But what's important about that is the higher the star rating is typically you've done a lot of work to make sure that people are staying out of the hospital and doing their checkups and all of those things to be healthy. But then the higher the star, if you get above 4 stars, it's a revenue change for us.
Mhm.
That means we can actually invest more dollars into the plan to get better benefits year over
Which
year.
is extremely important for the
Absolutely.
member. So let's talk about Louisiana. I'm super excited.
So
You have nearly 5,000 providers across the state of Louisiana with partnerships including Our Lady of the Lake, Our Lady of the Lords, St. Francis, LCMC, Toro, East Jefferson, and so much more.
mhm,
Now we are excited to say that Devoted is going to be offered in Louisiana, finally.
finally.
Jumping up and down inside. So why was Louisiana such an important market for Devoted to make an impact in?
It's if you look at the chronic conditions here in Louisiana, and the target, you'll see that we have chronic condition plans coming out and those type of
Mhm.
things that focus on trying to get people healthier. And we wanted to start in the Baton Rouge, New Orleans market. So those are our 2 focus points, and we're going to grow fast. So you'll see us continual grow in parishes all across the state over the next few years.
So as of October 1st,
Mhm.
this video should be dropping. And anyone in the New Orleans or Baton Rouge market can call the Fossil Group and ask about Devoted. They have the
Absolutely.
opportunity to join that plan for the beginning of January, January 1st of 2026. It's so exciting.
It is, and we have a unique partnership with y'all, and we really appreciate,
Yeah, we're so excited.
yeah.
Yeah. So how does this provider network give such peace of mind to our local families?
Yeah, you have a lot of these, LCMC is going to be a great partner of ours.
Hmm.
That is a company that is focused on quality of care. It's really amazing when you look at the transition and the investments they've made for better quality of care, and it aligns perfectly with us. I think they even have a heart in their logo,
Yeah, they do. Uh-huh.
so it's kind of perfect, right?
Yeah.
But we want to partner with doctors that have that same thought process of wanting that quality of care and wanting
The
good
same
partners.
culture, yeah.
Exactly,
You
same
wanna and
culture.
that's why we align so well because
Mhm.
the culture is just so similar,
Right.
about taking care of the senior and the quality of the care. And it's not about a sales pitch. It's about making sure the senior is where they need to be.
Absolutely.
The gold standard of insurance is what we say we are, and we take pride in that. So it's so exciting that we get to finally offer Devoted to our clients
Yeah.
and citizens across the state. So since 2019, Devoted has grown to 20 states. That's huge. By 2026, you'll be in 9 more states and nearly 400 new counties, covering almost half of the Medicare Advantage population. How do you expect to expand without losing the family feel?
This is awesome. This is a great question because every time we expand, we did a major expansion last year as well.
Mhm.
And everybody's like, there's no way you're going to still answer the phone in 30 seconds. We're like, call us.
Yeah, watch.
Watch us.
Mhm.
It's really amazing because we do. So Ed has a great vision.
Mhm.
He can really see things before they happen. It's amazing the mind that guy has, and
Yeah.
he's built an amazing team around him. We all work shoulder to shoulder, so he's not one of those CEOs that just is up here,
Untouchable, yeah.
and he's actually with us on a regular basis, working in the markets.
Mhm.
And when he builds a team, he builds it out to make sure that it can sustain that kind of growth, because we don't want to lose that feel. When changes come through Medicare, you'll see benefits change and go up and down from time to time. The one thing that we never want to change at Devoted, and it has never changed since we started, has been the level of service. And every time we've expanded, we've met that demand.
It's
So it's been
incredible.
amazing.
I think one of the important things to know about creating a team that is going to keep your business successful, and we preach it here, is introducing potential leaders to the table and allowing them to become a leader and be able to assist you in building what you have in mind. Because as a solid human, one specific human like Ed, he
Hmm.
couldn't do it all himself.
No,
It
no.
takes a true leader to be able to invite potential leaders to the table to be able to create something like Devoted, right?
Right.
Yeah.
Our entire team is empowered to do the right thing. And so Ed always talks about this, like in our claims department, for example.
Mhm.
He says to our claims department, who's paying all the bills, right? He said, if you're faced with a claim that you're just not sure of, the first thing you should think about is, if this was my mother, my father, my uncle, my aunt,
Mhm.
whatever, would I do this for them?
Right.
That's the number one question. Number two is it compliant to pay
Right.
it?
Well, I love it because one of the things that my mom has always said for years, owning this agency for 13 years and then being in Medicare before owning the agency, I always asked her when I was a child, like, why do you do insurance? Like,
Mhm.
why do you want to do that? And she would say, well, I mean, if it were me and it was your grandfather sitting down with someone else, I would want to know that he's taken care of,
Right.
you know? And I can attest to that being in the business myself for 8 years now. It is That's my why. It is so important to me to know that the senior population is okay and
Right.
that if they come to us, they're taken care of, they leave here with peace of mind. And that I mean, we've had daughters and sons come in with their parents before because they're nervous about sending them on their own and them being taken advantage of. And when they leave, they're like, thank you so much. Like, it is so comforting to know that you took care of what they needed. Their health care is so important, especially at this age,
Yeah.
you know? And it's so sad because call centers across the country and, there are bad apples that just kind of tarnish the industry. And I know insurance has its own reputation of being a scam,
Hmm.
and it's not, and it's a resource. And when you find plans like Devoted and agencies like the Fussell Group that can help you, it's just a pro to have.
Yeah, I think that's key. Connecting locally, like
Mhm.
with the Fussell Group, and having that one-on-one time with the agents, I think is really critical because there are some bad apples out there, of course.
Mhm.
There isn't any industry, but to your point, that's why I can't believe it took me so long to find this. I'm
Mhm.
50 years old, and I didn't find this industry. I found it by accident, actually, about 15 or 16 years ago. And I've always had a heart for helping people,
Mhm.
and I always wanted to help more and more people. So I'm on a couple of search and rescue teams. I have a search and rescue dog,
I love it.
all those type of things. But
Yeah.
one thing I could never figure out is how can I help like masses of people?
Mhm.
And then I got
Make a
introduced to
difference.
this, and
Yeah,
it's the most amazing industry ever because you
it
literally
is.
listen to the need of the person and then present the plans available that would make the most sense for them to choose from.
To
And it's
help
just a
them, to
awesome.
comfort them, to bring them that peace of mind.
Yeah.
Yeah, it's important.
Mhm.
Um, so how do you see the expansion of Devoted over the next year and then in 5 years from now? Hopefully, we're all over the state of Louisiana very soon.
Mhm.
But where do you see it?
I see continued rapid growth, and again, it's going to be very natural. You're going to see because we are changing the industry in a lot of ways,
Mhm.
and I totally see if you think this growth this year looks big at 9 states, I would expect next year is going to be as big or bigger.
It's so exciting.
Yeah,
Yeah,
and it's natural
and
growth.
for us to be able to offer that to our clients,
Hmm.
knowing the culture that you guys have created at Devoted and the customer service and the way that things are run and all of those things, it's so comforting for us to be able to say, look, this is a plan that we represent, that we like, know, and trust. And we know, hey, if you call, you're going to be answered within 30 seconds, right? That's record time. You
Exactly.
can't even warm your cup of coffee that fast.
Right.
So for anyone listening right now, maybe they're turning 65 or they're a parent um, of they are a child of a parent turning 65. Like I said a minute ago, sometimes we have that. We have the children that come in with them. Children in their 40s, they want to come in with their parents because they want to make sure they're making the right decision. What advice would you give them as they consider their options?
I would say the first thing would be to sit with an agency like Puzzle Group. I think that's key to
Hmm.
be with a local agent they can trust that's in their community. And then the next thing I would say is be with a company like Devoted that actually wraps their arms around you. They actually care.
Right,
We're a company that doesn't just say something; we actually do something, and we
right.
mean it. So I think that's critical as well. And if we don't have the plan that suits their needs, maybe some of the docs aren't quite in network yet, make sure that they look at other companies that may be similar, as close to ours as they can.
Yeah.
There's no one like us, but
Yeah.
you can get as close as you can.
Yeah, right. So I think too what's important and it's a misconception, and we'll wrap it up here, but
Mm.
is that a lot of people think that you have to pay for our service as an independent agent. And here at the Fussell Group, you don't, and you shouldn't anywhere else either.
Right.
But our service of sitting down, looking at their doctors, their hospitals, their prescriptions, all of that is right outside our door. So we're comfortable with all of those networks. All our service to them and doing that and spending that time with them and answering their questions all throughout the year, reviewing their plan, their annual notice of change during annual enrollment. It's all free to
Yeah,
them, and they don't realize that because thankfully we get compensated by the plan.
you're right.
And what also, I mean, I know this isn't known, but it's important to call out is that as an agent, we're paid the same commission across the board.
Right.
So it's our job to make sure that we put them on the plan that's right for them, right?
That's right.
And not it's not a sales pitch. It's
Exactly.
all about giving them the knowledge they need to make the right decision for themselves.
That's right.
So
100%.
I'm so excited that we get to represent Devoted in Louisiana.
We're loving to have y'all be here and to serve the community.
And I'm even more pumped for the AEP kickoff next week. Y'all are our huge sponsor,
Oh yeah, we have some
our gold
surprises.
sponsor. So we're excited to show you guys to our agents and let them hear all the good stuff about Devoted that we've heard.
Can't wait.
Well, thank you, Eric, for being here today and for introducing Devoted Health to our community. To our listeners, if you'd like to learn more about Devoted Health plans, visit their website or give us a call here at the Fussell Group. We will be able to discuss anything devoted related as of October 1st of 2025 and get you enrolled in a plan for January 1st of 2026 if it's something that works for you and if you're interested. So we hope that you'll explore your options, and if devoted is the right fit, we're here to help. That's it for today's episode of the Lagniappe. Eric, until next time, thank you so much for being here.
Appreciate coming on. Thank you.
Thanks for joining us on the Lagniappe. We hope today gave you the little something extra that you needed. Be sure to subscribe, share this with a friend, and follow us on social at FGIALA for more tools to live well and make the right decisions for your health and future. Until next time, stay golden, stay the course, and never forget, we'll be there for you.